Today, we're plunging into, well, a topic that often feels like a bit of a hidden minefield for millions approaching retirement: Medicare late enrollment penalties. Think of it like this. Maybe your friend Sarah, just turned 67, suddenly finds this unexpected permanent extra charge on her Medicare bill.
Right. Happens all the time.
Exactly. So our mission today is really to show you exactly why Sarah might be paying that, how it's calculated, and, crucially, how you can avoid becoming that Sarah. This isn't just about complex rules. It's really about protecting your hard-earned retirement savings.
It really is. It's almost like a silent tax for not knowing the rules.
Yeah.
But today, we're pulling back the curtain.
Good.
Because these penalties, they're honestly one of the most costly, yet almost entirely avoidable mistakes in planning for healthcare and retirement.
Costly how?
We're talking about extra costs, potentially hundreds, even thousands of dollars added to your Medicare expenses every single year.
Wow.
And not just for a few years, for the rest of your life.
For life, okay.
Yeah. The rules can be complex. Missing deadlines has these, well, severe financial consequences. So yeah, this deep dive is pretty essential.
Okay, so if it's such a big deal and it's avoidable, why? Why do these penalties even exist? What's the actual purpose behind them?
That's a great place to start. The main purpose is really twofold. Encourage people to enroll on time and help keep Medicare financially stable.
Stable how?
Well, imagine if there were no penalties, right? Healthy folks might just think, I'll wait. I'll sign up only when I get sick and need expensive care.
Right, that makes sense. Delay the cost.
Exactly. But if that happens, Medicare ends up with, way more sick people than healthy people paying in, which drives up costs for everyone who did enroll on time.
Ah, I see. Risk pooling.
Precisely. The penalties act as a deterrent to that kind of strategic delay. And they also sort of compensate the system for the added risk when people join later. It just reflects that Medicare is fundamentally an insurance program. It needs contributions from everyone, healthy and sick, to stay afloat long term.
Okay, so it's about fairness and keeping the whole system financially sound. Makes sense. But if that's the why, let's get into the how. Because you mentioned these aren't just one single fee, right? They seem to vary quite a bit depending on the part of Medicare.
You're absolutely right. The rules are quite different for each part. Let's start with Part A, hospital insurance.
Okay.
Now, these penalties, they're actually pretty uncommon.
Oh, why is that?
Because most Americans, after working and paying Medicare taxes for years, they qualify for Part A premium-free through their own work history, or maybe a spouse's.
Gotcha. So most people don't pay a Part A premium anyway.
Correct. But here's the catch. If you don't qualify for that premium-free Part A, maybe you have a shorter work history, and you decide you want to buy it, well, then you can get penalized if you delay signing up past your initial window.
Okay, so who does that typically affect then?
Good question. It tends to affect individuals with maybe limited work histories in the U.S., certain immigrants, perhaps people who worked for employers that didn't pay into Social Security, like some state or local government jobs years ago.
Right.
For them, the penalty is usually 10% of whatever the monthly Part A premium is, and you pay that extra 10% for twice the number of years you delayed enrollment.
Twice the years. So wait, if someone delayed Part A enrollment for, say, 2 years?
They'd pay a 20% penalty.
No, wait, 10% for twice the years.
Yeah.
So a 40% penalty. Oh, hang on. Let me reread the outline here. Ah, okay. You pay the 10% extra for twice the number of years you could have had Part A but didn't. So if you delayed 2 years, you pay the 10% penalty for 4 years. Is that right?
Yes, you're correct. Apologies, slight correction there. It's 10% extra on the premium, paid for twice the number of years you delayed. So a 2-year delay means paying the 10% penalty for 4 years. A 5-year delay means paying it for 10 years.
Got it. Okay. Still significant for those affected. Now, Part B. That seems to be the one everyone talks about, where people really run into trouble. And it hits harder.
It certainly is. Part B, your medical insurance, the penalties there are definitely the most common and, yeah, often the most financially significant.
Okay, break it down for us.
Okay, so for each full 12-month period that you could have had Part B but didn't sign up, and you didn't have other qualifying health coverage, we call that creditable coverage, and we'll circle back to that.
Right, creditable coverage, important term.
Very. So for each year you delay without that coverage, the penalty is an additional 10% of the standard Part B premium.
Added on top.
Added right on top. And here's the absolute kicker, the most crucial part. These Part B penalties, they are permanent.
Permanent. Okay, that's huge. So
Yeah.
not just for a few years like the Part A one, potentially.
Nope. Permanent means permanent. For the entire time you have Part B coverage for the rest of your life.
Wow. So if someone delayed Part B by just one single year, that's an extra 10% on their monthly bill. Forever.
Forever.
Yep.
Exactly. And it adds up fast. Let's use the 2024 numbers. The standard Part B premium is $174.70 a month.
Okay.
Delaying by just 1 year means an extra $17.47 a month every month. But what if someone delayed, say, 3 years?
That's 30% extra.
Right. 30% on top of the $174.70. That's an extra $52.41 every single month.
Over $600 a year.
Over $600 a year, every single year, for life. Just for delaying 3 years. That's money that could be used elsewhere in retirement.
Absolutely. A significant hit.
And it gets worse, actually. There's a compounding effect.
How so?
That penalty percentage, the 10% per year of delay, it's calculated based on the standard Part B premium for the current year. And that standard premium usually goes up a bit each year.
So the dollar amount of your penalty also goes up over time.
Exactly. That 10% or 20% or 30% penalty gets applied to a bigger base number as the years go by. So a mistake made early on just becomes more and more expensive.
Ouch. Okay, that really underscores the need to get Part B timing right. What about Part D? The prescription drug coverage. It has its own penalty structure too, doesn't it? Feels maybe a bit more subtle.
It is a bit different, yeah. The Part D penalty applies if you go without what Medicare calls creditable prescription drug coverage for any continuous period of 63 days or more after your initial enrollment period is over.
Creditable again. So coverage that's considered at least as good as a standard Medicare Part D plan.
Precisely. If you don't have that and you delay enrolling in a Part D plan, you face a penalty. The calculation here is 1% of the national base beneficiary premium for Part D.
Okay.
For each full month you were delayed and didn't have creditable coverage.
Each month, not year.
Each month. So for 2024, that national base premium is $34.70.
Right.
So 1% of that is about 35 cents, roughly.
35 cents per month of delay. Okay, that sounds tiny, almost negligible compared to Part B.
It sounds tiny, but don't let that fool you. First, like Part B, this penalty also accumulates month after month. And second, yes, it's also permanent.
Permanent again.
Okay.
Yeah.
So let's say someone delays enrolling in Part D for 2 years. That's 24 months.
Right.
So 24 months times, let's round it to $0.35 per month. That's an extra $8.40 every single month.
Okay, not so tiny when you add it up like that.
And that $8.40 or whatever calculates for your delay gets added on top of whatever monthly premium you pay for the specific Part D plan you eventually choose.
So it just makes your drug coverage more expensive indefinitely.
Indefinitely. It's another one of those things where a small oversight early on can lead to, well, a persistent lifelong cost.
Got it. And just quickly, what about Medicare Advantage plans? Part C, do they pile on their own penalties?
Thankfully, no. Medicare Advantage plans Part C don't have their own separate late enrollment penalties.
Okay, good.
However, and this is critical to even enroll in a Medicare Advantage plan, you first must be enrolled in original Medicare, meaning Part A and Part B.
Right.
So if you delayed enrolling in Part A or Part B and incurred penalties there, those penalties will follow you. You'll still pay them even if you get your benefits through a Medicare Advantage plan.
So the underlying A and B penalties still apply?
They absolutely do. And one other point, if you're in an Advantage plan, maybe one that includes drug coverage, and then later you decide to switch back to original Medicare and get a standalone Part D plan, you could trigger the Part D penalty if there was a gap in your creditable drug coverage somewhere along the way, either before you joined the Advantage plan or if the Advantage plan itself wasn't considered creditable for some reason.
Okay. Lots of interconnected pieces there. So this brings us to the really practical part. What does this all mean for you, the listener? How can you actually steer clear of these, potentially huge financial hits? Sounds like there are ways out, specific situations or strategies.
Yes, absolutely. It's not just about hitting 65 and signing up blindly. Medicare does understand life happens, so there are what they call special enrollment periods, or SEPs. These are specific windows of time outside your initial sign-up period where you can enroll or make changes, often penalty-free, because of certain life events.
Like what? What's the most common one?
By far the most common, and probably most important for avoiding the Part B penalty especially, relates to having health coverage from an employer.
Okay. For people who keep working past 65, right?
Exactly. If you or your spouse are actively working and you have group health coverage through that current employment, that coverage is usually considered creditable.
Active employment, that's key.
Crucial distinction. If you have that active employer coverage, you can typically delay enrolling in Part B and sometimes Part A if you'd have to pay a premium without facing penalties later on.
Okay, so you delay while working. What happens when you stop working or lose that coverage?
Then your special enrollment period kicks in. You generally have an 8-month window starting the month after that employment ends or the group health plan coverage ends, whichever happens first, to sign up for Part A and Part B without penalty.
8 months. Okay.
But here's a really common tripwire. COBRA.
Right. Continuing your employer coverage after leaving the job.
Yes. COBRA coverage, or retiree health coverage, generally does not count as coverage based on current active employment. So relying on COBRA beyond that initial 8-month SEP window after leaving your job, that usually leads straight to Part B penalties when you eventually sign up for Medicare. It's a huge misconception.
Wow, okay. That's a critical warning. So COBRA doesn't protect you indefinitely. Are there other SEPs besides the employer coverage one?
Yes, there are others, though maybe less frequent. Things like losing other types of coverage like Medicaid, or moving outside your current plan service area, or maybe qualifying for extra help, which helps with Part D costs. Certain other life changes can trigger them too. But they all have very specific rules, timelines, and often require, proof.
Documentation. That sounds like it's vital across the board here, especially with this creditable coverage idea for avoiding Part B and Part D penalties. What exactly counts and how do you prove it?
It really is the bedrock. So for Part D, creditable coverage means prescription drug coverage that Medicare believes is, on average, at least as good as standard Medicare Part D coverage.
How do you know if your plan is?
Your plan administrator, whether it's your employer, your union, TRICARE, or the VA, they are required to tell you each year whether your drug coverage is credible. Usually, you get a notice.
Okay, so look for that notice.
Absolutely. Don't just assume. Common examples that are often creditable include many employer or union plans, TRICARE, VA coverage, but always verify and keep those notices or any letters confirming your creditable coverage.
Keep the proof.
Yes, keep that documentation even after you leave the job or the plan ends, because if Medicare later questions why you didn't sign up for Part D or Part B if applicable, that paperwork is your evidence to avoid the penalty. It can save you a lot of hassle and money.
So, boiling it down, what are the core strategies to just avoid penalties altogether?
Number one, honestly, understand your enrollment periods and plan ahead. Don't wait until the last minute.
What's the main period again?
Your initial enrollment period, the IEP. That's your first and generally best chance. It starts 3 months before the month you turn 65, includes your birthday month, and ends 3 months after your birthday month, a 7-month window.
Okay, know your IEP.
Know your IEP. If you are planning to work past 65, like we discussed, check well before you turn 65 whether your employer health plan truly counts as credible coverage for both Part B and Part D purposes. Get it confirmed, preferably in writing.
Proactive checking.
Definitely. And for Part D specifically, the goal is no gaps. Maintain creditable drug coverage continuously. If you lose employer drug coverage, say, when you retire, sign up for a Part D plan right away during that SPA, even if you don't take many prescriptions right now.
Even if you don't need drugs yet. Why?
Because the penalty isn't based on whether you need drugs, it's based on whether you had a gap in creditable coverage. Signing up later, when you do need meds, will trigger that permanent penalty based on the gap you had earlier.
Ah, okay. Prevention is key. But let's say someone listening already got hit with a penalty, like our hypothetical Sarah. Is it just tough luck? Or is there any way to fight it?
No, it's not necessarily just bad luck. There is an appeals process. If you believe you've been assessed a penalty incorrectly, maybe Medicare didn't have the right information about your prior creditable coverage, or there were really specific unavoidable circumstances.
Like a serious illness preventing you from enrolling.
Exactly. Things like that. You can file an appeal with Medicare. You'll need to provide evidence, documentation, again, those coverage notices, employment records, maybe medical information, depending on the reason for the appeal.
So documentation is key for appeals too.
Absolutely critical. Appeals can be successful if you have a strong case and the proof, but honestly, it's much, much easier to avoid the penalty in the first place through careful planning than it is to try and get it overturned later. Prevention is definitely the best medicine here.
That makes perfect sense. And thinking about that planning, connecting this to the bigger picture, it's clearly not a one-size-fits-all situation, is it? Different life circumstances seem to need really different tailored approaches. It almost feels like you need to become a mini Medicare expert yourself.
It can feel that way sometimes. And you're right, different situations require different strategies. Maybe the most common mistake I see, people assuming Any health coverage they have after 65 automatically protects them from penalties, like we talked about with COBRA, or sometimes retiree plans that aren't linked to current work.
Right, that active employment distinction again.
Exactly. So just quickly for different groups.
Yeah, let's run through a few.
Okay. For most retirees turning 65, generally sign up during your initial enrollment period. Simple as that. Unless you have that specific active spouse employer coverage, don't delay.
Got it.
Oh, yeah.
What about workers staying employed past 65?
That requires careful coordination. Verify your employer plan's credible status for B&D. Understand your SEP timing for when you eventually do stop working. Talk to HR, maybe even consult Medicare resources.
Okay. And people with health savings accounts, HSAs, I hear that's tricky.
It is. Big one here. You cannot contribute to an HSA once any part of your Medicare coverage starts, even just premium-free Part A.
Oh, wow. Not just when you turn 65, but when Medicare actually starts.
Correct. So you need to time stopping those HSA contributions very carefully around your Medicare enrollment to maximize the HSA benefit, but avoid tax issues and potential Medicare enrollment delays that could cause penalties.
Tricky timing. And military retirees with TRICARE.
Yeah, TRICARE users generally need to enroll in Medicare Part A and Part B when they first become eligible, usually at 65, to keep their TRICARE coverage. TRICARE for Life acts as a supplement to Medicare. So understanding how they coordinate is key. Delaying Medicare usually isn't an option without jeopardizing TRICARE.
Okay. Lots of nuances. Are things changing much, or are these rules pretty set?
Well, the core penalty structures have been in place a long time. There have been policy changes like making RA a big law affecting how doctors are paid, which also made some tweaks around enrollment flexibility. But the fundamental penalty system, that remains. The best advice is always stay informed through official sources like Medicare.gov.
Absolutely. So wrapping this up, what does this all mean for you listening right now? I think the big takeaway from this deep dive is crystal clear. These Medicare late enrollment penalties, they're a serious financial risk, definitely, but they seem almost entirely avoidable.
They really are. With the right information and planning, just understanding how the penalties work for Part A, Part B, and Part D, knowing about the exceptions like special enrollment periods, especially the one for employer coverage, that empowers you. It lets you make informed choices to protect both your health coverage and, just as importantly, your finances in retirement.
And that permanent nature you mentioned.
Exactly. The fact that most of these penalties stick with you for life just makes prevention, that proactive planning, so much more valuable than trying to fix it after the fact.
So here's a final thought to leave you with. Think about how these penalties, even if they seem like just $10, $20, $20, $50 extra a month, can really accumulate over 10, 20, 30 years of retirement. It can become a significant, unnecessary drain on your savings. Making this kind of planning, understanding these rules, not just about healthcare choices, but really a fundamental cornerstone of your long-term financial security. It's the difference between potentially smooth sailing and hitting a completely avoidable and expensive reef.